Well, αγαπητές κυρίες και κύριοι, dear ladies and gentlemen, I will proceed with with our next session. Take your time. Take your time to have your seats. And we will soon be connected with Berlin. So, once more, I invite you to take your seats. Distinguished guests, ladies and gentlemen, welcome to our Fireside Chat. And we are now connected with Berlin already. I take just a few seconds to help you follow us and get to understand what we're going to be discussing about. So, what does the pharmaceutical industry mean for Europe? 840,000 employees, of which 1 in 7 is employed in research. 42 billion are invested every year in research. And we all Europeans believe this is something we are very good at. And it's called R&D. Well, I have to say this is not exactly the case, as we keep losing ground for 20 years in a row. And as a result, today only 1 out of 5 new treatments comes from Europe, while 1 in 2 comes from the United States. It is a complete turnaround compared to the year 2000. And guess what? European investment in pharmaceutical research fell from 41% to 31% in just 20 years as a part of the global investment. Saying that, I have the privilege to invite Stefan Ehrlich, a member of the Board of Management of Bayer AG and President of its Pharmaceutical Division, a position he has held since November 2018. Welcome, Stefan. Also, Vice President of the European Federation of Pharmaceutical Industries, EFPA. I remind us all, represents the biopharmaceutical industry operating in Europe through its direct membership of 37 national associations, 38 leading pharmaceutical companies, and a growing number of small and medium-sized enterprises. There's a new proposal now of the European Commission on the table concerning intellectual property rights, among other things. So, one of the core objectives of the European Commission's proposal is to enhance the availability, access and affordability of medicines while ensuring EU competitiveness, and it sounds okay initially. Nevertheless, the European biopharma industry does not agree with this proposal. Why? The question, Stefan.
Thanks for the question, Fotis, and hello everyone, and thanks for having me for this fireside chat. So, of course, we do agree with the Commission that we want to balance patient access and EU competitiveness. And you mentioned some aspects of the declining competitiveness, but there are some really concerning aspects in this proposal from the standpoint of the innovative pharma industry. You mentioned this. We've traditionally been leaders in innovation, we continue to actually be leaders in science and in scientific ideas coming out of our universities and out of academia. But we often now struggle to turn them into products and businesses here in Europe. The region isn't as good at securing intellectual property and making capital available to bring these innovations to life as the Americans that you just mentioned. A broader funding base is therefore needed, alongside a clear commitment at the various state and governmental levels that innovation is valued and will be truly rewarded. Healthcare must be recognized as an investment like it used to be, rather than just a cost. And we've seen in, I think, the previous session with the health minister, how much they're struggling with cost. So some aspects of the current proposal are clearly not heading in the right direction. We believe that this proposal would weaken the protection of intellectual property across the entire EU, and with that it would undermine pharmaceutical research and development in Europe. Let me be very clear, unless any private enterprise can generate some level of return on investment, things will just not happen, and the development of respective medicines will not happen. So if the time shortens, there will not be enough time to recoup the investments, given the high risk of what we do. So the question is not when IP rights expire and generics enter the market. The question is actually whether an innovation, a new medical product, will actually reach patients at all. So to remain attractive for the pharma industry and at the same time guarantee patients timely access to medicine, the EU needs to offer a much more level playing field with some of the other geographies that you mentioned. Therefore, the revision of this pharma legislation is an incredible opportunity. It could be even seen as a once-in-a-generation opportunity to ensure that we remain a strong innovator on the global scale. So it is important to get it right. Without this, European patients will be left behind, as you mentioned. A lot of the innovation are not hitting our market anymore, not meeting our patients anymore. And of course, we will also be left behind from an industrial perspective. So as a company that's deeply rooted in Europe and with significant contribution to European R&D, we here at Bayer, and I personally, advocate for a revision of the current proposal on the table.
Wouldn't small countries like Greece, though, benefit from a reduction in a regulatory data protection period? What would you say about that?
Yeah. You know, it's a little bit along the lines I just mentioned. The current proposal, I think, fails to address the root causes of medicine availability and access delays across Europe. And we confound things here. Patient access in member states is dependent on so many factors. Largely, it's influenced by national factors that are beyond the innovator's control. Look at, for example, how long a patient has to wait until an innovation hits their respective system. For instance, in Greece, a Greek patient, they would have to wait 587 days, while a German patient waits for only 126 days. However, that fast availability for German patients is also related to national policies that facilitate that. So member states' regulatory processes, healthcare strategies, and systems primarily determine access, and not so much what the innovator wants or does not want. So cutting regulatory data protection won't resolve any of these access issues, and to the contrary, risks undermining the European pharma industry. So take Greece's healthcare system, which was really hit hard by the economic crisis just a few years back. And of course, you imposed mandatory discounts, paybacks, we heard about the clawback. All of this reached over 70%, which is in Europe is the highest price cuts, and also at the same time increased co-payments by patients. Despite a 65% market growth, public investments plummeted by 23%, and that exacerbated actually the medicine shortage and the withdrawals that you have been experiencing in Greece. So this demonstrates that reducing regulatory data protection won't address access challenges at all. Therefore, we believe that linking RDP to patient access overlooks the complexity of national healthcare systems and also of market dynamics.
Now, I'll use just one more figure. because I need to express my feeling that there's a new player around and we have to start considering of him. According to the latest data, the pharmaceutical industry in Europe has already seen a 25% fall in its share of global R&D investment over the past 2 decades, while China now carries out 3 times more trials for advanced therapies than Europe. Can we reverse that trend?
Well, I think, and I would hope that we can, but we need to have a different approach than what we have today. You mentioned some of the numbers. 20 years ago, the US outspent Europe on R&D by just $2 billion per year. That gap has widened to $20 billion outspending of US of Europe. Europe's share of global clinical trials fell to just about 20% in 2020. That's down a quarter, as you just mentioned. So this has consequences for European patients as where clinical trials happen. And as to China, when you think about what's going on in China, it's very similar. We're seeing more and more happening there also. So we need to create an environment in which we want to carry out innovation here. And typically, it starts with market friendliness, and that is obviously lacking. And you mentioned the more than 800,000 jobs and the contributions to our sector to the EU economy. And obviously, this is not just 800,000 jobs. It's typically also 800,000 jobs that are high-paying jobs, that are jobs that typically induce more jobs in adjacent industries. And we can't afford, as Europe, that very much relies on technologies and industries that are not necessarily rooted in the 21st century, to use one of the most vibrant sectors of our time. So yes, we can turn that around.
You are representing the European pharmaceutical industries indeed, but you also lead the pharmaceuticals division of Bayer in Germany. So taking Bayer as an example, my question is, why are incentives and strong regulatory frameworks so important for a company of that size and of that kind?
Well, ultimately because we have choices. We have choices where we want to make our investments. And the truth is, companies like mine, we're so strongly rooted in Europe so that we almost have no choice but maintaining some of the investments that we're making in Europe. But for new investments and for new technologies, we have choices. And if I look at my recent investments, we have disproportionately invested in the US market, because US is not home just to the most attractive market and market conditions. It's also very much home to many of the vibrant biotech industries that we very often collaborate with, or sometimes also acquire. So we as Europeans want to have a level playing field and sort of like create the same type of availability to capital. With the availability of capital, you have a vibrant ecosystem for biotech industries. And if you add to that a good regulatory framework, that creates incentives for innovation to stay here instead of moving over to the US, or now with China very strongly supporting the sector of building a new sector in China, which until recently didn't even exist. So Europe is much more a bystander and watching things happening instead of really taking things in their own hands. And I repeat, this is one of these industries of the 21st century that we have a very strong academic base for. So we have all the ingredients to make this a strong European industry.
It is not a secret that EU citizens face inequalities in access to new and innovative medicines. Wouldn't the mandatory launch in all EU countries at the same time, within 2 years, improve patients' access?
Well, it sounds really good, and on the forefront, I could not say no. But when you think about this and you look a little bit into the facts, you have to see that most launch delays or denials to be reimbursed are due to national policies and procedures and not industry choices. I mentioned some of the delay differences between countries, but if you think about, and I'll give you some very concrete examples of what's really happening, I have two examples in my head, and I've used them actually now frequently. One is, if you take a country like Croatia, we as a company, we face bureaucratic issues requiring up to 10 reimbursement decisions before the payer could assess the application, 10 reimbursement decisions in other countries. So if we have to wait for 10 other countries before we get reimbursed, then it sort of becomes a vicious circle, and we will never get to the 2 years in all countries if we have to wait for 2 years in some of them until we can even start a process. So that's local ruling. In Belgium, we had a reimbursement request that was rejected because the local payer demanded data comparing our medicine to competitors that hadn't even been launched yet in Belgium. So another sort of like a circular reference, and unfortunately we're faced with this quite often. So believe me, we have a real interest in coming to as many patients in Europe as soon as possible. It's actually our economic interest to do so. So you can see that these examples highlight that there are bureaucratic rules in play that hinder us from doing that and to getting to all of these patients. So I'm very happy to see that the European Parliament seems to have recognized also that the majority of factors determining medicines available are beyond the control of individual companies, and they have therefore released an opinion about the Commission's proposal.
And which do you believe should be the regulatory changes that have the potential to enhance Europe's competitiveness?
Well, to boost Europe's competitiveness in the global market, we need to strengthen, not weaken, IP protection for new medicines and vaccines, and this proposal that's on the table from the Commission does the opposite. So we need to create favorable conditions that will encourage companies to invest in research, development, and manufacturing in Europe. And innovation should stay in Europe. When they come out of our universities, they should stay here and be accessible to our citizens. Currently, many new medicines, and I think you mentioned that have been approved by the FDA in the United States don't reach Europe because companies, especially in biotech, they're no longer conducting trials here. So this negative trend must be reversed because it's going to really have it's going to weigh in on the quality of care that patients in Europe will receive. The European Council, which represents EU governments, concluded in March of last year that Europe should strengthen incentives for medical innovation. Instead, we're sort of like doing the opposite. So reducing data exclusivity from 8 to 6 would be a step in the wrong direction, making the EU much less attractive than it already is for R&D investment. It needs to go the other way around. We need robust IP protection, we need support of innovation, and we need to ensure that European citizens actually get access to the innovations and the inventions that are coming out of Europe, instead all of them going to US or now also to China and being developed there.
Well, as we're coming out of the European elections now, what would you expect from the new European Commission and the new European Parliament regarding the future of the European pharmaceutical industry? And actually, is there an optimistic scenario, an optimistic expectation?
So if I wasn't optimistic about the future, then probably I should change my headquarters from Berlin, which you see here in the back in the reflection. So you see the Berlin tower here, to the US probably. Well, I'm not doing that, and we're not doing that because we think we have a tremendous future in Europe. We live in Europe. We have our children here in Europe, and we want to contribute to the wealth of this continent. I think the previous Commission has shown during the COVID-19 crisis that our system can work and can be resilient and can base itself on economic strength and also underscore the crucial role that innovation can play. We saw it like never before in combating the pandemic, leveraging our investments into vaccine and therapeutic technologies and really coming up faster than ever with solutions that were based on innovation. I think it's a great example for tackling some of humanity's biggest problems through innovation. Now, what we're seeing also that recently, with everything that's happening on the geopolitical stage, we've been deprioritized somewhat, and I would hope that we can change that direction under the new Commission. Health should always be a top priority on the next EU policy agenda. You mentioned the employment, but if you think about what health contributes to our economy across the board, from physicians that treat patients, from hospitals that provide care, down to pharmacies that provide medicines, and industry that provides all of them with novel medications. This is one of the most important sector, and in most countries it is actually percentage-wise the biggest sector of GDP contribution. So it must be a priority, and we must be ambitious when it comes to an industrial strategy for health. I think Greece can play an important way and lead the way towards a more competitive, healthier and stronger Europe, fulfilling our shared vision of better health for all together.
Well, Stefan, I cannot, first of all, I need to thank you a lot for joining SfEE Summit from Berlin. I need to say to you that I was surprised, talking about innovation and innovative stuff, watching Euro in Germany last night, where this kind of new sensor inside the ball at soccer, at football, helped the referees recognize a mistake of a Belgian forward, but anyways, that's for the football fans. From your answers, I want to stress, and I'm keeping definitely two things. Integration and cohesion are two key words in EU's history, and I now believe it also applies for health and pharma, or it has to at least. So, Stefan, thank you so much for joining us from Berlin.
Thank you for having me. Thank you. It's a pleasure.